Do we know what that number is of the 49,000?
We have approximately 37,000 out of the 49 who have one provider.
Who have one provider?
Who have one provider. The remaining have multiples of 2, 3, 4, and up.
Okay.
So there's roughly 12,000 who have the multiple providers already.
Okay.
But the other thing that I
go
just
ahead.
want to say is when you're looking at the consumer's hours at 160 per month, that doesn't necessarily translate to the providers who could be working cross recipients who would have work above the 160 or 40 hour in a week.
So I guess that's my next question, because once I get the government's answer on that, I want to relate it to private individuals. So I guess if you have a multiple provider that takes care of 2 individuals, and each person requires 22 hours a week, that is basically 4 hours of overtime. Or how are you, is that considered overtime in the governor's proposal, or is that considered 2 separate employers per se, being the providers, and that person will still get 22 hours paid for Mr. Chesborough's care and 22 hours paid for my care? Does that make sense?
Yes.
Okay.
In the part of what the federal rule did was it also said in those states in which the state can be considered a third-party employer, the hours are cumulative. So in that situation that you described as only one grove, that would be 4 hours of overtime. So in order to accommodate that dynamic in establishing the work week agreement that Ms. Carroll described, we would have to sort of enter into an understanding that between the 2 consumers, the hours didn't exceed 40 hours, and the spread would have to be worked out between the 2.
So I guess my question is if you have a employee that's an IHSS employee and they work, they've managed to obtain 2 consumer clients that they take care of, and they work 22 hours or 21 hours, anything exceeding 40 hours in a total for those 2 consumer care clients, that's going to be considered overtime even if they work for 2 separate clients?
Yes, it will be. Overtime to the IHSS program. Now, if they work for an additional consumer who is not an IHSS recipient, but is a private pay consumer, that does not affect the IHSS overtime dynamic.
Okay, wait, that's a good point that you made, because I'd like you to clarify that and put it on the record for me again.
For the purposes of the IHSS program, we're not trying to limit all employees in home care in California to 40 hours. What we are saying is within the context of the IHSS public program that we operate, within that program, we're proposing a cap of 40 hours weekly.
Okay, so I'm a provider, and I'm just trying to give you an example so we can understand the question. So I'm a provider, and I provide care to a private pay individual and an IHSS individual, a consumer, both consumers. And my employee works, 30 hours at the private pay company or the private pay consumer and 15 hours at the IHSS provider. Under the law and the way it's changed now, that employee working both of those places in private pay and IHSS are entitled to overtime.
They are not, because they have separate employers in those instances. Because the third-party employer would only kick in, i.e. the state becoming third-party employer, if both of the consumers were IHSS recipients or the waiver program, the small 1,300-person program on the side of the program.
What if I'm talking about a private agency employer? A private agency employer that both provides private pay and government IHSS. They both deal with consumers either, and I know I'm getting the names mixed up, and I apologize. You have a consumer that's private pay, and you have a consumer that is IHSS pay, or government or state paid, county paid. I guess my question is that I, as the provider or the agency provider, am paying, as an employer of record, paying the paycheck, W-2, taxes, all of that stuff. And so as an agency, do I have to make sure that I don't cross over my 2 client consumers?
No. It would be analogous to if an individual worked 30 hours at Safeway and 30 hours at Bonds.
So you're identifying the employer of record as the consumer themselves.
In the private situation, it would either be the consumer, if they're not hiring the person through a home care private agency, or it would be the home care agency. If the person working for the private home care agency works more than 40 hours, then under the federal rule, the private home care agency has an overtime obligation. If they're working less than 40 hours and are working less than 40 hours in the IHSS program, neither program has an overtime exposure.
Okay, so the IHSS program goes from Sunday to Saturday as a pay period week.
Yeah.
So I'm an agency, and just what you said, the agency would have the obligation to pay the overtime. So I guess my question is that as an agency, my employee works Monday, Tuesday, Wednesday, and Thursday, and they work 26 hours for my private pay, or let's just say 40 hours, make it easy for my private pay client. And then they work 8 hours on Friday for the IHSS services. Technically, under the law, in the labor code, the client being at the end of the work week with the additional hours would be billed the overtime. But that particular client is refusing to pay overtime with the threat of a suspension for no services, which I'm going to ask about the impact on skilled nursing facilities next. So I guess my question is that how as a private agency do I charge the beginning of the work week with overtime when the overtime didn't occur at the beginning of the work week? It occurred at the end of the work week when they're at the IHSS client.
Under the construction of the FLSA rule, the provider would have to work more than 40 hours for one or other employer in order to have incurred an overtime obligation. If they, and I was using the analogy as if somebody works at two supermarkets that are different corporations, neither supermarket has an overtime obligation. Now, if somebody worked at two branches of Safeway Company for 30 hours each, then Safeway, the employer, has an obligation.
I understand that.
Right. So it would be analogous to that in the private care environment versus the IHSS compensated environment.
I'm just asking about dual environment, if in a dual environment. So if one employee, I as a provider, and I'm not trying to be, I'm trying to just get this on the records because I have agencies that have blown up my phone wanting to know how this is going to affect them because they deal with both IHSS services and they deal with private pay.
Right. In terms of the agencies, there are only two contract agencies currently authorized to operate in IHSS in California. One is Adults Healthcare, which operates in 2 counties, and then San Francisco City and County has a private consortium which functions as a contract agency, but it's a private nonprofit. It doesn't serve in any other county. ADUS may have a situation where in their small number of contract hours clients under IHSS, they may have a provider who is also serving non-IHSS. That would incur overtime. The number of IHSS clients who are in the ADUS program are, how many?
We have less than 1,800.
Less than 1,800 statewide being served in that ADUS contract.
In San Francisco.
And San Francisco, the San Francisco Consortium. So there may be a few instances where somebody's working for, I think the IHSS Consortium in San Francisco only serves IHSS. So ADUS may have private pay customers whom could cumulatively add to an overtime obligation.
Okay, so I guess I apologize for my, not play on words, but my versus consumer versus client and those kinds of things, the words that I'm not getting right, and I do apologize for that, but I appreciate that information. I guess a regional center would be a client of someone providing services that are contracted, but they also supply or have subcontracts, I guess, with private providers that have dual employment or dual employees at the same employee at dual places.
Yes.
So I guess the concern that they have is that do they need to eliminate all their IHSS clients? Number one is the concern they have. Do they need to figure out a way if the state is going to pay at the end of the work week for the overtime because the private pay held at the beginning of the work week?
I see where- yes,
Okay,
I
so
see.
that's the concerns they have, and I told them I would try to get those answers from someone.
Eileen, do you-
We have had several conversations on this issue with the DDS population.
Great.
And because they are covered under the new rule, but they're not part of the IHSS program. So their 40 hours would be contingent solely on the work that the regional center is having them do, and it's on a subcontractor basis. So the relationships are very different is what I'm trying to get to. We're talking about
Right.
control of an agency, being able to determine people's hours and ensure that if they want them to work overtime, it's an approved overtime situation. This is very different from a self-directed consumer model.
And I appreciate that. So can I still go or not, Madam Chair?
Yes, let's reach a conclusion on this matter real soon.
This one's conclused.
Okay,
This
good.
I just have a different, so I guess my question is, I appreciate the governor trying to rein in what was exposed last year as a lot of fraud in the IHSS system. I know that there is great care that goes into it, but sometimes there are people that take advantage of it, and I get that, but that's not the majority of the people. That's not the majority. So I appreciate what the governor's trying to do. I really do. I think he's trying to figure out a way to balance it. My question, I guess, or my concern is that if a consumer needs care and you can't authorize your care to have overtime, and if they do get overtime, there's a warning notice, and if they go over it twice, like the LAO said, if they have overtime over 2 times, and it says it's a 1-year suspension, is that 2 times in a 1-month period, 2 times in a 12-month period, or is that 2 times in the life of receiving IHSS care?
I think that's part of some of the future discussions that we're going to be having. The trailer bill is silent to the length of time, so it could be the entire term of employment, or it could be in future discussions something that is defined.
Wow. Okay. And then I guess on that same subject, I wanted to know if there was an impact done on any skilled nursing facilities, because this is my concern. I represent a lot of rural areas. I have people that, if there's not a backup plan or there's not someone that is going to be able to provide Plan B if they need somebody to be there for the next 2 hours, and they exceed that overtime limit, and then you suspend their services, and this person has to be at home without services for a year with no means of paying for those services, without IHSS providers, those people are going to end up in a skilled nursing facility paid for by the state, which is a higher 3-4 times. I don't know what the amount is. So I guess my question is that I know, and I'm not saying that that's going to happen all the time. I'm just saying that there is a possibility that's going to happen, and I would like that discussion to take place, because I don't think that they should. I mean, I think it's good that we're trying to curtail the issue that we have with IHS services. I just don't agree with the hard-hitting hammer that's coming down that someone's going to completely be taken off of services if they need services and they have to pay overtime to get it.
Could I clarify?
Sure.
Something? The limit is not on the services that the individual consumer can get from the program. It's on the limit is on how many hours they can get from one provider. If there is a sanction because someone has worked overtime in excess of the work week agreements on a repeated basis, the sanction is not to the consumer. The consumer is still entitled, if they've been approved for
it's to the
200
worker.
hours, they still are entitled to 200 hours.
It's the worker.
It's the
My complete misunderstanding.
Right, but I don't want to minimize the fact that there is a challenge in being sure that we can always find, as the LAO was pointing out, replacement workers, and that is part of the part of the hard lift involved in putting this together, is being sure that we build systems that can do that. And I don't want to minimize the difficulty of it.
Okay, we've got
Thank you very
a
much.
lengthy agenda. Does anyone else have any questions of the administration? Okay, fine. Thank you very much. Let's have our second panel. We have a very long agenda. If you guys keep asking these long questions, I'm not going to let you leave before I leave. No, it's strict. Our second panel is consisting of Brandy Wolf, who's the Deputy Policy Director for SEIU, Tammy Stiles, provider for Mendocino County, Michelle Rousey, I think it's Rousey, excuse me, consumer in Alameda County, and Gary Passmore, Vice President of Congress of California Seniors. Is that correct? Sounds wonderful. We do have time limits on this, and as you can see, our time is rapidly going because we have a lot of, obviously, public hearing. So we're going to start with Brandy, and you're going to make some brief introductory remarks to introduce Tammy. Is that correct? Okay, good. Thank you.
We're on. Okay. I'm Brandy Wolf. I'm the Deputy Policy Director with United Long-Term Care Workers Local of SEIU. That is actually all of my comments. I'm just going to introduce Tammy Stiles. She's a home care provider with ULTCW.
Good afternoon. My name is Tammy Stiles, and my husband is Robert Stiles. And we're here today from Mendocino County to share with you our personal story and to press upon you the importance of restoring the 7% cut to IHSS hours as part of this year's state budget. In 1998, my husband was diagnosed with ALS, also known as Lou Gehrig's disease, and over the years, as his condition worsened, I become his full-time caregiver. It's not an easy job, nor is it a job that pays well. But it's a job that keeps our family together by giving Robert the care he needs in the place he wants to be, and that's at home. In fact, I attribute the home care program to Robert Bean, a 16-year survivor of ALS, while others who are diagnosed with the same condition after Robert have lost their lives already to this battle. Robert continues to fight on, and I'm really proud of him for what he's doing, just to keep going with this. So as Robert's caregiver, I assist him with every aspect of daily life. Anything you can think of, I'm here to help. Unless you have been in my shoes, I'm sure you just can't imagine what a normal day is like for us. So let me tell you, getting him up in the morning because he can't get up on his own anymore. He lost his hands, and he lost the use of his hands and his feet. This man used to roller skate. He used to do things, be alive one day, and it all got taken away. And now he can't make it to a refrigerator to feed himself. He can't go to the toilet on his own. These are the things that we have to do daily with him. When he gets sick, I have to clean those messes for him. I have to go find the duty of getting an appointment for him and getting him seen. And it's really sad. It's really sad in the things that we have to go through to get these things met for him. But it's worth it. Because he's my husband, and he's the one I chose to be with. And that sounds like a lot, and it is. And needless to say, there's not much time to have a second job, obviously. He brought down an entertainment center on top of him one day. And I had to come home and help him with that. And that's why I had decided to do this job, was to be with him. So when the state cut IHS hours to balance the budget, you can understand how scared home care consumers and workers are. These cuts impact the ability for hundreds of thousands of caregivers like me to pay the bills. And just recently, they raised our rent $30, and I have to pay that. I have no say to that. And I do it because I live in America, and I'm following in my part with that. And they jeopardize the amount of care our consumers receive. Whether you're someone like Robert who's allocated 260 hours right now because they've cut us of care a month, or someone who receives 10 hours a month, every hour or care is a vital hour of care not essential to their ability to remain safely at home with the dignity and respect they deserve. For Robert, the cuts have resulted in 20 less hours a month on me. And just because the budget was cut by 7% doesn't mean that everyone's health condition improved by 7% and the hours of care needed magically disappear. The need remains, and that is why we must work to restore these hours. While today, before the Budget Subcommittee, we may think of the IHSS program as a budget line item, it's more than that. It's much more than that. This program is a lifeline that delivers dignity and respect to those who need our help and saves taxpayers millions of dollars every year. And during the recession, we all made sacrifices. Unfortunately, those sacrifices came at the expense of our most vulnerable Californians. But when we worked together to pass Proposition 30, we got our state back on track, and it's time that we work together to get our IHSS program back on track by restoring these vital hours of care. Our seniors, our loved ones with disabilities, and those who provide them with care deserve nothing less. We have the ability to restore the hours of care that were taken, and it's time that we make that happen. Thank you.
Next presenter. We're going to ask that you hold your applause so that we can get through our panel.
Madam Chair, may I make a suggestion to the audience?
Yes.
One of our previous chairs encouraged the audience to engage in the sign language equivalent of clapping, which didn't take up the time that we want to have to allow people to speak. So just offer that as an option.
Sounds good.
With your permission.
No problem. Tammy Stiles. Oh, she just spoke. I'm sorry, Michelle.
The county social worker using the strict IHSS guidelines says I need 142.4 hours of care a month to stay at home safely, but I don't get that. I lost 11.4 hours last July. I get what I need. I don't get what I need. I get 131 hours. My IHSS cuts have not been made up by any other sources. No, I've gone without those hours altogether. I've had a full effect of the 8% cut. Where in my hours did I cut the 8% out of? It's been difficult. I've had to make very hard choices. I've had my home looking a lot better and being a lot cleaner in the past. But what really takes a priority is my personal care. But even that has had a hard hit in hours. Here's what the 11.4 hours represents. I get a total of 9 hours of assistance per week for bathing and grooming. So if I cut out bathing for a week and cut out getting my laundry done and my kitchen cleaned, and that would cut 11.4 hours. Is that what I'm expected to do? The month still has 4 weeks, but I don't have 4 weeks worth of help. I've had to cut back bathing, but if you're wet, full of crap, and other things, you just don't want to be told you can't have a bath because you're out of hours. If you need a bath, something else gets moved off the list for that day. The problem is when there are no more hours to do with, and there is still needs that you have for those things to be done, and done of care in your home, then what? But I, like all IHSS consumers, have needs that have to be met. It's not that we want them to be met, they must be met. The state's own rules about IHSS says that these things must get done for us to continue to live independently in the community. Isn't that what IHSS is all about and meant to do? Isn't that what Olmstead decision is about? And every year I'm being told to do more with less. I can't continue to do it. I deal with multiple cuts and cuts on top of cuts with a huge impact over time. My worker has been with me for over 20 years. So over the last year, she has continued to endure the same 8% cut as I have. She is a sweet and nice and doesn't work for free. I need help, and I need more help than I've had before the cuts, and long-term effect of these cuts means for me, I need more help now than I did. Go figure. The long-term effects for me When I get enough IHSS, it keeps me out of the hospital, and down the road I have, heaven forbids, I see going into the hospital again. Repeal the 8%, and then the 7 cut down effective in July this year. No more cuts, ongoing cuts to the IHSS program, fully funded. Thank you.
Gary?
Don't we have one other witness?
I had Brandy, Tammy, Michelle, and Gary.
Oh, okay, I think there was someone else added before me. I'm supposed to conclude.
Who else was added?
Vivian Deniston.
No, I don't have you on our list. Who do you represent? Were you invited to be a panelist?
Yes.
Okay. By the committee or by someone else?
I believe she's replacing Jane Cardis, who you had in your list.
No one told us that Jane had a replacement.
Yeah, I'm sorry.
Okay, fine. Yeah, no one told us there was a replacement. They just told Jane wasn't coming. Okay.
Okay, thank you. Good afternoon. My name is Vivian Deniston. I'm an in-home support services provider from Humboldt County, the area represented by Assemblyman Wesley Chesbrough. I am also a member of the California United Home Care Workers Union that represents IHSS workers in 25 counties. I'm here at the Capitol today to give you a glimpse on what it takes to be a home care provider, so you understand that being a caregiver isn't a 9-to-5 occupation. I work more than 40 hours per week caring for my 30-year-old daughter who is here with me today. She is autistic, bipolar, and an amputee. Each day, I help her get in and out of bed, I bathe her, and help her with her medication. I make sure that she eats properly and makes the most of her day, either through education or activities that keep her a part of society. While many children leave home after high school, she has become my lifelong companion. I've dedicated my life to her, and we are a team until one of us is no longer here. The idea that Governor Jerry Brown would take my daughter's care and put it into the hands of a stranger shows a lack of respect to the services that we've provided and to the state's most vulnerable men and women. Put yourself in my shoes. On Monday, you open the door and you find a random provider to care for your loved one. On Tuesday, someone else is at the door. On Wednesday, and so on and so on. A stranger who lacks the training coming to my home and caring for my daughter, I won't stand for this revolving door proposed by the governor, and neither will the men and women who are in the audience today. Home care providers must be compassionate and dedicated to the men and women we care for each day. It's not enough to be a caretaker or a body in the house supervising an individual. It is about what is right for these men and women. Home care recipients may not earn a living, but they have earned quality health care in the environment that is suitable and comfortable. Capping caregiver hours at 40 hours per week is a disservice to my daughter and the hundreds and thousands of others in the state. Thank you.
Thank you, Dr. Weber and members. I'm Gary Passmore with the Congress of California Seniors, and IHSS has always been a top priority of our organization. Makes sense because 58% of the IHSS population are seniors, people over the age of 65, and in fact, 1 in 4 are over the age of 85. So this is definitely a major concern of ours. They may have dementia, they may suffer from several chronic diseases, or simply be too frail to live on their own at home. And we're really troubled by the governor's proposal to cut services, and know that these services have been documented as necessary services for people to remain in their homes. I think you've heard some very compelling testimony here, far more direct than I could ever provide, by people whose lives are diminished and people whose lives are put at risk by the proposed budget cut. The administration's budget's really an anachronism. The fact is that it's based on a time when the state was making huge cuts to programs and services because we were in a very deep financial hole, and those cuts were required to eliminate deficits. It's a result of a settlement to avoid greater cuts. And the settlement doesn't require that you, the legislature, approve these cuts. It was intended to put a cap on cuts. And I think that that's an important distinction to make. Like you, we watch state revenues and we look at the projections. And this budget starts with a really large surplus, and it ends with a really large surplus. And state revenues are coming in right now higher than what were in the projections that were the basis for the governor's budget. I think it's likely we're going to see a budget surplus of well over $7 billion by the time the May revise is put out. The state is proposing to raise pay for state employees. There are panels looking at raising your pay of public officials. We have restored a good bit of money to the public schools. Most of the money they've cut, we're putting money back into higher education, into the courts, and we're even stitching some of the big holes in the provider safety net. But we are, at the same time, cutting home care. And it's very troublesome. The only reason that we're given is to build a bigger surplus. It isn't like these services aren't needed or the population isn't growing. We just want to bank money. I want each of you to remember that the state isn't forced to make these cuts. Not this year. The state chooses to make these cuts this year. And you choose it in order to increase your surplus. Very quickly, I can guarantee you that somewhere in this big state of ours today, there's an elderly woman, probably incontinent, living in her own room, and either lying or sitting in soiled clothing. And she's probably going to face hours and hours in that condition because of this very budget cut. And we urge you, as people with conscience, urge you to please reject this proposal and eliminate the 7% across the board cut. Thanks.